Christina, I'm gonna be your student nurse practitioner today. I'm gonna be doing your head to toe physical assessment. Okay. Before I'm gonna start, is there anything new today that you want to tell me?
No.
No. Um, do you know where you are right now?
I'm in the house.
In the house. Yeah. Do you know what time is it?
It's 1 o'clock.
1 o'clock. Yeah. Do you know what year today is?
2024.
And do you know where who's the president right now?
Biden.
And do you know what we're gonna be doing?
Assessment.
It's physical assessment, right? So you look calm, cooperative, not in distress, breathing okay. I don't see anything that is like really abnormal as a general physical appearance. First, I'm gonna be doing some head, inspection. Just want to like see your face and no facial drooping, no can you smile for me? Good. No, it's equal symmetry. Everything looks good for me right now. I don't see any redness, no lesions, anything. Um, then maybe I'll just have to like go ahead and check your hair, okay? Yeah, it looks like you have equal distribution of hair, and your hair looks good, not brittle. No, yeah, your head is no masses, no bumps or anything there. Is it hurting when I touch you?
Mm-mm.
No. All right. Um, I don't see any infestation or breakdown or any baldness. Next, I'm gonna be checking your eyes. Okay. Um, we're gonna be. Can you like close your eyes for me? Really tight. Open your eyes. Okay. And we're gonna be. Your eyes is just like equal symmetry. No lid lag. So I think we're okay there. Next, I'm gonna be doing your, probably just do your optic nerve, uh, cranial nerve number two. Um, we're gonna be testing your peripheral vision. Okay. Um, can you like close your? I'll cover one of your eyes, and then I'm gonna like show you. Tell me how many fingers I'm like showing you. Okay. Uh, cover your eyes. How many finger?
One.
How about this time?
Two.
How about this time?
Two.
Okay, this time.
One.
Cover your eyes again. Your other eye. Okay, this one.
One.
This one.
Two.
Okay, this one.
Two.
Good. Next, we're gonna be doing your peripheral vision still, but I'm gonna be like making sure that you can like see the peripheries of your eyes when I like bring this pen from your back. Tell me if you already see it from the side of your eyes. Okay.
Yes.
Yes. Okay. How about this one?
Yes.
Okay. How about the shaking of my hand?
Yes.
Now, okay. So she has good peripheral eye vision. We're gonna be checking your vision right now. We're gonna be doing some Snellen test, and I'll be like doing. We're gonna be checking your eyes if it's normal or not. I'm gonna be counting here for 6 feet. 1, 2, 3, 4, 5, 6. And can you tell me which one is the one that you can read farthest?
Okay. CFDHJ.
CFDHJ. Oh, your vision is 2020. Oh, yeah, 2025. So that means that your vision is you can see normally on 20. 20. For most people, they can see it at 25 feet. Okay. Next is we're gonna be cover. We're gonna be doing some fundoscopic exam on your eyes and like see if you know there's something there. I just want to like inspect it. I forget to inspect. Do you have any like irritation or dryness in your eyes? No. How about I don't see any redness, no exudates or anything. I'm gonna be checking your pupils. Okay. Hold on. I just want to like flash some on your eyes. Okay. I'll just open it. Okay. Alright. It's reactive to light. It's normal, equal at around 3 mm diameter. I'm gonna be next is I'm gonna be checking your eyes for fundoscopic exam. Okay. Hold on. I'll just increase the magnifier for this one. Okay. Just look at my ears. Sorry. Okay, next. I don't see anything abnormal with your eyes. No AB leaking, looks pink inside, so there's no redness or anything, or erythema or something in there. So next, I'm gonna be inspect fundoscopic exam. We're gonna be doing the 6 cardinal gaze. If you can, just follow this pen. Okay, I'll just want to like see how your eyes are tracking this pen. First, we're gonna move it to the up, okay, down, side, up, down. Okay, looks like everything is okay. Your eyes is following my pen, and so it looks normal. No nystagmus or anything, or weakness in both of your eyes. Next, we're gonna be checking for your accommodation. I'm gonna be like bringing this pen towards the center of your nose. Just keep your eyes focused to the pen, okay? Another one, another one. Good. Your eyes is tracking it. Both of them are like equally going to the center of your nose. So that's good. Next is I'm gonna be checking your ears. And just to like see what's going on, but I'm gonna inspect it first. There's no tophi, no deposits over there. It's clean and good. So I'll just want to like see, the inside of it and see your tympanic membrane. Okay. It's pearly white and no redness or discharges or anything there. Is it hurting? No? Okay. Next is okay. Yeah, it's still the same. There's no redness or anything, no erythema, no discharges that I can see, and it's clean. Next is I'm gonna be palpating. I'm sorry, I'm gonna be palpating your mastoid process. Is it hurting or anything? While I'm palpating, I'll just go ahead and do your whisper test. Okay, Tell me if you can hear what I'm whispering. 1, 2, 3.
1, 2, 3.
Good. Can you tell me if you can hear it? 1,
1, 2, 3.
2, 3. Good. Thank you. Your hearing is really good. Next is we're gonna be doing your Weber's test, and I'm gonna be putting this one at the center of your forehead to see if there's like deficits on your ear. Okay. Stop. Okay. Thank you. Is there a difference in your hearing? No. So it's equal on both ears. Next is I'm gonna be doing some Riley's test to see if you have a sensory neural hearing loss. Tell me when it stops, okay? No more. You cannot hear it anymore. Okay. Tell me when it stops and you cannot hear it. Okay, you cannot hear it anymore. So, yeah, your bone conduction to your left ear is lesser than your air conduction, and that's normal. Okay. Okay, I'm gonna tap it, and then if you don't hear it anymore, just let me know.
Okay, stop.
Okay. Okay. So yeah, air conduction is longer on both ears, and then bone conduction is shorter on both ears, and those are normal. Next is we're gonna be doing your check your nose and see if there's something going on. I'm gonna be using this otoscope to like see. Looks pink, no discharges. Okay, I'm gonna be close one of your nose, block it, and then breathe in, breathe out. Okay, there's no obstruction. Breathe in, breathe out. Good, because sometimes sinuses will gonna block your airway. I'm gonna be palpating your maxillary sinuses. Is it hurting? How about this one? Frontal sinuses. Is it hurting? No. Okay. So those are that's still normal. Next is I'm gonna let you smell something and tell me what it is. Okay. This is this, and let's see if she can guess it. Pepper, good. You can really smell it, and you guess it right. So next, I'm gonna move down to your mouth, and I'm gonna be checking your lips, and your lips is not cracked. Can you smile for me? Good. And then open your mouth, close your mouth. While you're opening and close your mouth, I want to like see your mouth. Oh, close. Okay, good. I was just checking your masseter, and I'm gonna be checking the inside of your mouth to like see what's inside, and I'm gonna be using this tongue depressor to like check everything in there all at once. Okay. Okay. Open your mouth. Oh, stick out your tongue, move it side to side, the tongue, up and down. Okay, open your mouth some more. I just want to see your uvula. Okay, stand. Okay, good. I want to like see the side of your buccal cheeks. It's clear, nothing there. can you stick your tongue up so I can see the under your tongue? Good. And then, okay. And then here, I'm gonna be like, sticking, putting this one on your tongue, and then you say ah, okay? So to see your uvula to go up.
Ah.
Some more.
Ah.
Good. Yeah, it's normal. Your tonsils is not swollen, it's pink, and no exudates that I can see. Next is I'm gonna be doing already did your tongue, pink, lesions, moist, and your medulla is midline, so we're good there. I'll also check your cranial nerve number 9. When I did your gag reflex, you were able to swallow. Can you swallow? Okay, good. You should have a good gag reflex, and your cranial nerve number 10, which is vagus, you should be okay because there's your sternocleidomastoid is not contracted or relaxed, and then your neck you can swallow, and you have the gag reflex also, and your heart rate is okay. Next is I'm gonna be checking your neck. Okay. Looks midline to me. I'll just palpate. Okay. Okay. Nothing. While I'm palpating, I'm gonna be checking your lymph nodes. Okay. This is your first lymph node. Nothing hurting there. It's not hurting. Mandible, mental, and then there's more. There's a couple more here at the back of your sternocleidomastoid. Here, nothing. Is it hurting? No mass. And then here and under here. Okay. I don't see anything. I don't palpate any lymphadenopathy. In your neck, can you raise your shoulders? Shrug. Raise up like this. Down. Okay. I'm gonna be putting up pressure. Okay, good. You're able to put it up. Okay, midline. And while I'm checking your neck, I'll just go ahead and check your carotids, okay? Carotid pulse, one at a time. Okay, +3 bonding. Okay, right there, it's bonding also. Next, I'm gonna be just checking your JVD and do your do the JVD so that we could get away from it. Okay, right away. If you can lay back like this, about 30-degree angle. Okay, right. I think that's good. Yeah. So we were gonna be checking for your neck. Checking for the pulsations. I don't see any pulsations over here. So I will just, this is the manubrium, this is the sternum, and this is the angle of Louis. So because I couldn't see it, I'm gonna press your tummy to just express the carotid pulse. Yeah, with that, I can see the carotid pulse pulsating over here. And so if that's the level, I'll just put a ruler on it and then put this one on your chest, and it should be here. It's 4 centimeters, and so that's normal. Yeah. Next is I'm gonna be doing your assessment for your respiratory. So maybe I'll just do respiratory. In my outline, I think I'll just go with my outline. It's the upper extremity, so we'll just do some range of motion, and palpation and anything. So I'll just inspect your arm, okay, with good muscle turgor, normal, okay, and see. Good. Can I see your, can you grip my hand? Okay. I just want to like see your fingers. I don't see any hybrids or butchered nodes. Okay. I'm gonna be flexing your fingers. Any pain or anything here? Any complaints? No. This is abduction, adduction, flexion, extension, and then how about your wrist? Do you have any pain when I do this? Adduction, abduction. Okay, over here, nothing. Do you feel anything? No. Okay. Okay. Adduction, abduction. Yeah, you hyperextend your fingers. Good. How about your other fingers? You find it good. And next, I'm gonna be checking your pulses. Check. Oh, it's still bounding. 2 plus, and then your brachial. It's still bounding. It's 2 plus. Okay. I want to like check the strength of your hand. Squeeze my hand next, and then what I want you to is push my hand. Good. It's strong. How about pull my hand? Okay, good. Next, I'm gonna be doing some ROM, range of motion on your elbow. Okay, this is flexion, extension, and internal rotation, external rotation. I'm gonna be doing some ROM to your shoulder. Okay. Good. This is flexion for the shoulder, extension for the shoulder. Is it hurting when I do this? Okay. One slowly drop your arm. Okay. The drop time is negative. Slowly. Does it hurt? No. Good. Yeah. And then this is adduction for the shoulder, abduction for the shoulder. We're gonna do on your other arm also, a little bit faster. This is flexion, extension, and then abduction, adduction, flexion, extension, internal rotation of the shoulder, external rotation of the shoulder, internal rotation of the elbow, external rotation of the elbow. Yeah, abduction, adduction of the hand, and yeah, I think everything's okay with your upper extremity. Your skin turgor is okay. I forgot to check your nails for capillary refill. Yeah, it's less than 2 seconds or 1 second. It's just less than 1 second. So that's really good, capillary refill. And when let me just feel your shoulder. Okay, do you feel anything that's like crepitus or like yeah, I don't feel any crepitus. Shoulder, elbow, and wrist. And next is I'll just do your lower extremities. I'm gonna be, since there's a sun over there, I'll just let you lay down here. Hopefully it can be seen by the camera. Yeah. Okay. You lay down. Okay. So for the lower extremities, we're gonna be, checking your muscles. Okay. Any pain when I touch you? No. How about here, in your legs? There's no edema. Good color. I don't see any like swelling, redness, and then she has good capillary feel. Let's see the pulses. Okay, she has good pulse. This is anterior tibia. Yeah, she has good pulse over here also. Next is I'm gonna do the hips. I'm gonna do external rotation of the left hip. Do you feel anything or pain? Okay. Flexion, extension, and then for your knee, do you feel anything here? No. Okay. Internal rotation, external rotation. How about can you like flexion for your ankle, and then dorsiflexion of your foot. Dorsiflexion, I think it's like this, and flexion, and then this is extension. Next is I'm gonna be checking if there's fluid to your knee. I'm gonna do cup test. Okay. Looks normal to me. Do you feel any pain over your knees? No tenderness? I just want you to flex your knees and then try to like pull it up. Okay, I don't see any like dislodgement or separation of the knee. Okay, yeah. It could be like around 3 centimeters, and that's good. Okay, I think that's all for the lower extremities. While you're laying down, I'm gonna be checking your Babinski reflex and see. Okay. Okay. Sorry. Okay. Yeah, it's fanning. Okay. So as you can see, it's like closing in, and that's normal. Okay. So she's just ticklish. Next, we're gonna be pulses. We're gonna be doing your chest examination. Okay, you can sit down. Maybe you can sit here. Let's see if we can be seen. Okay. Next. All right. Can you breathe in, breathe out? Good. Since I'm doing the anterior part, I'll just do the anterior part first. Breathe in. Okay. It's equal expansion. I don't see anything. There's no pulsations, no redness, basically nothing. It's normal. I'll just be listening to your lungs now. First, I'm gonna be listen to your trachea. Breathe. Okay. Breathe. Breathe. It's clear breath sounds. I don't see anything. I don't hear anything that is really abnormal about her anterior. Next is I'll just go ahead and auscultate her heart sounds, and that can be seen on the second. Okay, 1, 2. I'm listening for any heartbeat. There's one S2 and S2, S1 and S2 sound. That's the pulmonic. This is the herbs point. And this is the tricuspid. the mitral valve. I don't hear anything that is abnormal. It's just S1 and S2. I just want to like palpate the point of maximal impulse. Yeah, I can feel it. And I forgot to like auscultate the carotids, so I'll be auscultating it with the bell. Next. It's normal, I can hear it. No bruit, no trill or anything that I can hear. I'm gonna go back to your respiratory and inspect your back. We're gonna see your back. Can you breathe? Good. It's equal expansion, not I don't see anything. Okay. I'm gonna be doing some tactile perimeters. Can you tell me 99?
99.
Okay. Say 99.
99.
And then here.
99.
Yeah. I can feel the vibrations all throughout, so that's normal. Next is I'm gonna be checking for the AP diameter. So this is 1. If we compare it, it's 2. So the AP diameter is 1:2. So that's really normal. Next is I'm gonna be auscultating her lungs. Breathe. Yeah, you have equal breath sounds on all of your lungs, so that's good. I just want to like measure your, your inhalation and exhalation, just making sure that everything's okay there. Okay, I'm gonna be doing some percussion here, and it's expected that it will gonna be resonant. I just want to like let you take exhalation. Okay. So exhalation. Okay. Can you take a deep breath and exhale? Yeah, when your lungs is relaxed, when you exhale, it's over here. And now I want you to like inhale. Okay. Inhale. Let's measure it with a measuring. Yeah, it's at 3 to 4, 3.5 centimeters. So I think that's good. Let's just do another one on your back. Okay, inhale, exhale, deep breath, and then exhale. Yeah, stop here. Okay, now I want you to do inhalation. Okay, inhale. Yeah, it's on this part. We're gonna just measure it. It's still the same. It's 3.5 centimeters. So that's for the respiratory. We did vibration, diameter, and lastly is we're gonna be just doing your egophony. And every time my stethoscope will gonna touch your back, please say E, okay?
E, 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 E.
Okay. Good. There's no changes of your, the letter E. And now I want to hear bronchophony, okay? Every time you touch my stethoscope touches your back, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Good. As the stethoscope is going farther and it's slightly becoming diminished, so that means that it's normal. Next is I want you to whisper 99 every time my stethoscope will get touched to your back. Okay. Whisper. Good. I can still hear your whisper. So everything looks good. So we're gonna go down to your abdominal physical examination, and this means that I'm gonna let you lay down again. Sorry. Okay. I'm gonna be exposing your abdomen to just like see things, and also measuring tape. This is good. Okay. Right. I just want to inspect your abdomen and see if everything's okay. Yeah, looks okay. There's no redness. It's symmetrical. I don't see anything that is like protruding or anything there. So we're gonna be, there's no pulsations or peristalsis that I could see. Next is I'll just auscultate your abdomen for bowel sounds, okay? I could hear a bowel sound. So next I'm gonna be, while I'm auscultating, I'll just auscultate for your veins, your arteries, okay, for trios, bruit, and anything. I'm gonna do your aorta. This is the xiphoid. So I'm gonna be doing your aorta. Here. I could hear your aortic pulse. I don't see any pruvi and trio. Next is I'm gonna be auscultating your renal artery. I could hear it. I don't see any trio or pruvi also. Next is I'm gonna be doing your iliac artery. It's over here. could appreciate it, and your femoral arteries are on this side, I will just not assist it. Next is I'm gonna be going down to do some light palpation and deep palpation. Okay. Um, okay. Do you feel anything? Are you hurting? Okay. And then I'm gonna be doing some deep palpation. Okay. I'm sorry. I know you're ticklish. Okay. Okay. I don't see any like mass or anything. Next is I'm gonna be try to palpate your liver. Okay. Your liver. Okay. I'm gonna do some percussion first. Yeah, this is your stomach. And this is hyperresonant. Yeah, this is kind of like dull here. Next is I'm gonna be doing your liver, okay? Okay, this dull here. I want you to inhale, exhale. Okay, yeah, it's over here. So I'm gonna be measuring it again. It's 3.5 centimeters. So, and that's still normal. Next is gonna be assessing your abdomen for any peritoneal inflammation. Is it hurting on your back here? No? Okay, so there should be no peritoneal inflammation. Usually if there's peritoneal inflammation, you're gonna hurt mostly on this part here on your back. I'm gonna be doing some Murphy sign, and when I press, you inhale, okay? Exhale. Is it hurting? No? How about this is the Robson sign to like assess for appendicitis. The first one was to assess for cholecystitis, and this one is to assess for appendicitis. And I'm pressing, inhale, exhale. Is it hurting? And then when I like rebound tenderness, is it hurting? No? Okay, good. Next, I'm gonna be doing your Stowa sign. If I want to like flex your leg here. Okay. That hurting your tummy? No? Okay. And then we're gonna be doing your obturator test, wherein it's also to test for appendicitis. Okay. I'm gonna be doing like this. In there, external rotate, internal rotate. Is it hurting when I do that? No. Good. Yeah. I think that's for the stomach. I did assess your liver, but next is I'm gonna be trying to like palpate your kidneys. Okay. I just want to like bring it up. I really cannot, appreciate it, including the pancreas or the pancreas. I cannot like see, palpate it, and that's normal because if you can really palpate it sometimes, and then it's hurting, there's something going on there. Okay, is it hurting? No. Nothing. Alright. I'm sorry. I know you're ticklish. Next is I did not do your costovertebral. While you're laying down, I'll just do your check your aorta. The palpation of aorta, aortic pulse. I'll just touch it. Okay. About it's 4 centimeters, so that's normal. Okay. I want you to sit up. I just want to do a costovertebral angle, percussion. tell me if it's hurting, okay? Hurting? No. That means that you don't have UTI. If it's hurting, that means that you have UTI. Next is, I'm gonna go ahead with some of the cranial nerves if if we have not done it yet. I know I already asked you about mental status exam. Can you remember what I told you about what to whisper earlier?
What does it?
Oh, okay, that's good. You can remember long term and then short term. Do you know what's? Can you tell me what if I palpate across your back? Does that what does that mean? You have
For
UTI.
UTI.
Yeah. Okay. So yeah, basically, whenever you percuss on that one, you have UTI. Next is I just want you to smell. That like bring a coffee. Okay. I will close your eyes. I want you to smell it. What is it?
Coffee.
Okay. So yeah, that's it. Oh yeah, I let you smell the pepper earlier. We did the peripheral vision. We did Snellen test. Just checking what are the things that I forgot to do with the cranial nerves. We did nystagmus, pupils. I did the masseter. Touch your. Can you touch? Can you feel my hand when I touch you? Okay, good. And oh yeah, I forgot to do your corneal reflex. Just on the side. Good. You have good corneal reflex. Okay, good. Next is I forgot to do your cranial nerve number 7. Can you smile? Puff your cheeks. Good. I'll let you try this and see if can you close your eyes and then put your tongue out, and this is okay. Put your tongue out. What is it?
Sugar.
Oh, okay, good. Yeah. Next, we're gonna be. Oh, here. Just checking things that I forgot to like do. We did the vagus, we did spinal accessory, we did cardiac examination, motor. I did the motor, flexion, coordination. Oh, just the walking. Can you stand up? Like here. Walk normally towards there. Good. And then can you do toe to ankle walking? Good. Next is that tip walking, tiptoe walking, and then the other one was tip to ankle, right? Yeah, good. You have good coordination, toe to heel, everything stance is good. Next, I forgot to like do your Romberg's test. Close your eyes and then just keep standing for 1 minute. Checking for your balance. Okay, I think that's good. Okay, next is stand up and then keep your arms prone and then close your eyes. Just want to like see for the next minute. Okay, I think that's good. It's normal. You're not swaying. Your hand is not doing some the movement like internal rotation of your hand. So that's normal. No lesions in your brain or no neural deficits. Next is I'm gonna let you do some light touch and for your stereognosis, tell me if it's or light or hard touch. Okay.
Light, hard, hard,
This one.
light.
Okay, good. And next, I'm gonna be checking if you can tell if it's warm or cold. Okay. All right. This one.
Cold,
This one.
hot,
Okay.
hot, cold, hot.
Good. You have good stereognosis, and I want to know if with your eyes closed, if you can feel what I'm gonna be putting in your hand. What is this?
Pen,
Okay, good. And next is I'm gonna be and next I'm gonna be putting another one on your other hand to make sure that you can feel it.
it's cold.
Okay, so what is this object? Okay, thank you. That's then vibration. Next, we're gonna be doing some vibration to your finger, making sure that you can feel them. Okay. Okay, hold on.
Yeah,
Can you feel it?
yeah.
Okay, good. And then I'm gonna do it on your foot. Okay.
Yes.
Okay. You can feel it, so that's normal. Last discrimination. I just want you to localize, touch where I touch. I'll touch you, okay? Okay, here.
Right arm,
Okay.
left arm,
Okay. I want you to touch where I touch you now, okay?
point,
Okay, point. Okay, point where I touch you. Okay, good. How about next is extension. I already did that extension. Now I want you to sit down. I want you to do your pronation supination. You do like this. Okay, for coordination. Good. I want you to touch my finger and then touch your nose. Okay, touch my finger, touch your nose, and then your left arm. Touch my finger, touch your nose. Okay, good. Very good. Lastly, I'm gonna be doing some deep tendon reflexes. Next, first, I'm gonna be doing your biceps. Okay, good. Okay, good. Next is gonna be your triceps. Yeah, move. Next. Okay. We're gonna be doing your brachiorachalis. We'll be doing it like this. Okay, good. And this one. Okay, good. We're gonna be doing your knee jerk reflex or the knee reflex. Sit here. Just hang it, relax. Okay. Good. Good reflexes. Okay, good. And then I'll just do your ankle. I need to. Okay. I think I need to do it like this. Okay, good. Like that. Okay, good. Okay. Yeah. Yeah. I think that's all for the physical assessment for your head to toe. I didn't see anything that is abnormal, so you're good and everything is normal for you. Okay. Thank you.
Okay.